We begin with the latest in the new coronavirus outbreak. Canada has now recorded its fourth case, an Ontario woman in her 20s who recently traveled to China. The outbreak has now killed 258 people in China. Around the world, more than 11,000 cases have been confirmed. Most of them are in China. But the number of countries to detect the virus continues to grow. The United Kingdom, Sweden, and Russia announced their first cases today. That makes 26 countries and territories. In the U.S., where 6 cases have been confirmed, authorities are taking aggressive steps. They've declared the outbreak a public health emergency. And starting Sunday, the U.S. will deny entry to foreigners who have traveled to China in the last 2 weeks. They've also imposed a mandatory quarantine on nearly 200 Americans who were flown back from Wuhan.
We still have a low risk to the American public, but we want to keep it at a low risk. And because there are so many unknowns here, we're going to take the action in a temporary way to make sure we mitigate as best as we possibly can.
Here at home, health officials say the risk to Canadians is also low. They're urging people to remain calm. In tonight's top story, Heather Yourex-West takes a closer look at the newest Canadian case.
We're here today.
Health officials say Canada's fourth case of novel coronavirus has already fully recovered. The woman in her 20s from London, Ontario, had recently traveled to Wuhan, China, but had so little of the virus in her system, initial test results came back negative.
The test on this individual was done a week ago, and at the time, that was the very best test. It was the original test that we had all been working on collectively.
After running samples through a more sensitive test available only within the last few days, the results changed. And health officials don't believe any other person has been put at risk.
Every time she had contact with somebody in Canada, she was wearing a mask. Her disease parameters are quite low, and the system took all precautions when she was in contact with the hospital.
Canada may now have 4 confirmed cases of the new coronavirus, but the risk of infection remains low. That's not the case for those trapped in the outbreak's epicenter. Bin Zhang is a Calgary resident who's now stranded with his young family in Wuhan.
With 2 young children, we definitely want to be able to go back to Canada. They're more vulnerable. Their immune system is not as strong as adults, so we're definitely more concerned for them.
Zhang is hopeful his family will be allowed to leave on a Canadian government charter flight in the coming days, but their situation is complicated. Their children are Canadian citizens, but he and his wife are permanent residents.
If we are not allowed, then none of us are going, because I'm not sending a 3-year-old and a 7-month-old on a plane with somebody else.
Citizens of the UK, France, and the United States have now returned to their respective countries, where they are under a 14-day quarantine. But details about Canada's evacuation plan are still not known.
We are engaged with Chinese authorities around repatriating Canadians who are in China and concerned for their safety. It is a deliberate process in which we are engaged responsibly, and we will have more to say on that in the coming days.
Giving people like the Zhangs little else to do but wait as this international health emergency continues to play out around them. Heather Yourex-West, Global News, Calgary.
There's still a lot scientists don't know about the novel coronavirus, but here's what they can say about how it spreads. The coronavirus is transmitted from person to person through water droplets, created when an infected person talks, coughs, or sneezes. Just to give you a comparison, take measles. That virus can travel up to 30 meters in the air, making that disease highly contagious. But with the novel coronavirus, you must be within 2 meters of an infected person, and the water droplets must reach deep into your lungs. Scientists say you can absorb the droplets through your mouth, nose, or eyes. You could even contract the virus if you touch a contaminated surface, then touch your face. But scientists say the risk of transmission in that case is low, and proper precautions like regular hand washing can go a long way to stem the spread.